Time now for a Catholic Health update. And joining us here in the studio is Tim Kelchner, Director of Multimedia Content for Catholic Health. Welcome, Tim.
Thanks, Colleen. How are you?
I'm doing great.
Everything good. We have some good updates.
I'm healthy today. Great.
Healthy, good. And we have some timely updates, hopefully to keep everyone healthy today as well. Well, the calendar has turned to March. We're thinking about that warmer weather, some more sunshine, maybe even a trip to the beach. But right now, we are still in flu season, and we need to focus on protecting ourselves. According to the Centers for Disease Control and Prevention, since October, there have been at least 37 million infections, 480,000 hospitalizations, and 21,000 deaths due to influenza. In fact, the U.S. has seen the highest rate of doctor's visits for flu-like illnesses that includes influenza, COVID, and RSV in the past 15 years, which is why it's still so important to get the flu shot.
Yes, it does. It's always recommended, and again, it's based on your comorbidities, your risk factor. If you're older and you have other medical illnesses, we call them comorbidities, it places you at higher risk for complications. And that's the value of a flu shot. It's really been proven, according to evidence-based science, to decrease the risk of complication. You may still get the flu, but it's really the complications we are trying to prevent. And that is why we emphasize the importance of our patients getting the flu vaccine.
Some good advice, something that is timely, and again, something that we can all use to help us out. Alzheimer's disease is a type of dementia that is projected to impact 13 million Americans who are 85 years or older by 2050. A number of risk factors increase the chances of this disease. They include family history, genetics, and poor vascular health, among others. And at some point, 1 in 9 people over 65 will exhibit some symptoms of Alzheimer's disease. We spoke with Catholic Health's Chairman of Behavioral Health to learn how the disease is treated.
First, there is a thorough review of the patient's medical history and physical examination, many times including a neuropsychological testing. At times, brain scans and blood tests also will be useful and necessary. Once a diagnosis is made, what can be done? Well, there are medications, exercises that can help mitigate and slow down the onset of dementia caused by Alzheimer's disease. But there is a degree of clinical care that ultimately will be necessary.
Finally, today, sodium. Not exactly the most exciting part of your diet, but one that impacts all of us and helps to balance the amount of water in your body and also control your blood pressure. Too much sodium can lead to headaches, heart failure, kidney stones, and even stroke, among other issues. Spoke to one Catholic health expert about how much sodium we should strive for each day, and most importantly, how to keep your sodium in check.
We should try to obtain less than 2,000 milligrams of sodium in a day, which is hard to do because it's in every packaged food and all natural foods as well. But the general recommendation is less than 2,000 milligrams a day. When you're shopping, the best way to do that in the store anyway is to generally stick to the periphery of the grocery store. That's where the whole foods and the less processed foods generally are, and minimize your use of anything that comes in a package.
Boy, great advice. Tim, I want to get back to the flu because right now I am seeing so many people, they have it, and it's really hitting hard. It's not too late to get the shot yet, right?
No, I actually asked that exact question because I was curious. Normally, we push the flu shots a lot. We encourage people to get them in the fall. I said, Dr. Goolsarran, is now an appropriate time? She said, absolutely. Flu, as she mentioned, very high right now, and you want to do anything you can to protect yourself.
Okay, great.
All right,
As always, thank you. We'll see you soon.
All right, thanks, Colleen.
All righty.